Dr. Upton Siddons. I am working out at the Greenwood Family Practice Clinic with Baptist Health. I did all my training here in Arkansas. I went to the University of Arkansas in Medical Sciences. I have 4 children. They were all born in Arkansas, and my wife is from here as well. I grew up in Oklahoma, from Tulsa originally, but I've been in Arkansas here for about 19 or 20 years, so I consider it my home. I love Western Arkansas. I've always lived somewhere in the Arkansas River, and this is just a continuing trend in that. Having had some family members who were very close to me when I was younger who had a lot of long-term health problems, I really appreciated from a very early age that having a compassionate caregiver, whether that be a physician, a nurse, a care worker, something like that, can make all the difference from a family perspective. And that's an important thing to have. I found that when I got older, I really enjoyed giving back to people who needed things like that. And I saw it as being one of the more important things that I could do with my life. It gave me energy every day, and I saw a great need for it in a lot of the communities I lived in, compassionate care. So I'm grateful now to be a part of that and have that opportunity. I love being part of a community. I think primary care is one of the few, let alone medical professions, but professions that we have that allows you to just talk to almost everyone that's part of a community and to help them. They take you into their confidence and you help them, but you also get to learn about them as people, and you get to hopefully become friends with them. When you see them outside of the office, you're able to wave hello. If they have questions for you, they can come by and ask you a question, and I like that. I like feeling like I'm part of something and like I'm helping people. Certainly a number of my colleagues who do other specialties do great work, and I'm grateful they're there, but I certainly found the place that makes me happy and the place I feel I can make the most impact in people's lives. I always tell my patients I will do my best to treat them for anything that I'm qualified for. A lot of my patients have diabetes, congestive heart failure, hypertension. I see a lot of well children for just regular checkups. I do a lot of care for the aging as they get older and just need more routine care. I manage a lot of psychiatric medications. I find it's hard, unfortunately, in Arkansas to always get access to the mental health care that all of us need sometimes, and I feel grateful that I'm able to do that. I've had the training to do that in my profession. I take care of people that are acutely sick and may need to go to the hospital. I work closely with my colleagues that are in the hospitals in the community. I can do minor procedures. I take care of a lot of very young infants from birth onwards. In my training, I was fortunate enough, and I feel like I got excellent training and have excellent contacts in the state health department when it comes to managing patients with long-term chronic illnesses like HIV, AIDS, and hepatitis C. I feel very comfortable managing that. I have a number of patients that I treat with those conditions. I'm also qualified and waivered by the DEA to help with people with opiate use and other substance use disorders to connect with the type of help they need and attain the type of medicines they need to help them overcome those problems. You know, I believe something that gives me strength, and part of my mission as a physician is to display compassion and healing ministry throughout all the patients that come through. I always tell my patients that they are the captain of the ship and I'm just the navigator. I give them advice about where I think they should go from a medical perspective, but they make the choices. I certainly hope to go along with what I say, but I think if I had to tell my patients anything, it would be an ounce of prevention is worth a pound of cure. And that's something I try and do a lot. More than prescribe medicines, more than end up having to have surgery, I would love to see you and I would love to help you be your healthiest self and prevent ever getting sick in the first place.